Assalamu alaikum, I am Dr. Muhammad Salman Abid, working as a postgraduate resident in nephrology PIMS Hospital, Islamabad. As you all know that the blessed month of Ramadan is about to begin, as well as the health benefits it brings to us, as well as the deleterious effects it has on our body for not eating nor drinking for prolonged hours during the day. This is especially important to people with pre-existing comorbids such as diabetes mellitus. The global Muslim population is 1.6 billion, and among those 148 million Muslims are diabetics. There's a question that keeps bothering the patient with diabetes, is that whether they should fast or not. So the answer to this question is very simple, that if the patient with diabetes are well maintaining their blood sugar levels and the hemoglobin A1C, that is HbA1c, which is a record, 3-month record of the patient's blood sugar is 7.5 and 8 or in between these levels, provided they don't have any complication of diabetes, for instance renal failure, or they are not on dialysis, then the patients are allowed to fast. Changes. As you all know that during Ramadan, the normal daily routine completely changes, whether it's your diet, it's your exercise or your sleep pattern, it is changed. So the diabetic patients have to readjust their medication in order to remain well during fasting hours and even after that. The medication that they take at the morning time can be rescheduled to the Iftar time, and the medication that they take before dinner can be reduced a little and can be taken at suhoor time. In this way, they will remain healthy and avoid any hypoglycemic episodes. And it is always very wise to set up an appointment 1 or 1.5 months before Ramadan starts with the physician in order to discuss your fight with the diabetes, as well as to readjust your medication, so to prevent any complications. There should be a strict and healthy diet plan that should be followed during Ramadan. Fruits and milk should be used more often, and it is very important to keep your body well hydrated. Keep your water intake adequate from Iftar to suhoor, so there is plenty of water requirement that is already dealt with during those hours, and that will help you go through rest of the day. So there is a question that keeps bothering the diabetic patients, is whether they are allowed to check their blood sugar levels during the fasting hours or no. It is highly recommended and permissible that they check their blood sugar levels during the day, which includes suhoor, morning, midday, iftar, 2 hours after iftar, and whenever they feel that something is not right, something is wrong with them, they are having either hyperglycemia or hypoglycemia. God forbid, if some symptoms do show up, for instance dizziness, blackout or profuse sweating, then immediately get your blood sugar levels checked. If they are below 70 milligrams per deciliter or more than 300 milligrams per deciliter, then immediately break your fast. It is also advisable to be well prepared before Ramadan begins, and there should be a pre-Ramadan assessment for diabetic patients. Some key risks associated with diabetics who are fasting, and it's worth mentioning. For instance, they can develop either hypoglycemia, they can develop hyperglycemia, they can develop diabetic ketoacidosis, or they may develop dehydration and further thrombosis. Special populations need specific advice and close monitoring. For instance, people with type 1 diabetes are advised not to fast, but if they insist, then there should be a close monitoring of their blood glucose levels and their insulin should be readjusted. Similarly, pregnant women with gestational diabetes mellitus or pre-existing diabetes are advised not to fast. There are 10 principles of Ramadan nutrition plan. Number 1, divide an adequate amount of calories between suhoor and iftar. Number 2, meals should be balanced with 40 to 45% carbohydrates, then comes proteins, and in the end comes fat. Number 3, design your meals using the Ramadan plate method. Number 4, avoid sugar heavy desserts. Number 5, high fiber carbohydrates are preferable. Number 6, hydration should be maintained by drinking water during meals and non-sweetened beverages. Number 7, take suhoor as late as possible. Number 8, adequate protein and fat should be consumed at suhoor to induce satiety. Number 9, iftar should begin with water to rehydrate and 1 to 2 dates to build up the blood glucose levels. And number 10, low calorie snacks such as fruits and vegetables should be consumed between meals. In the end, I pray that we all remain healthy and good during Ramadan. Wishing you a very blessed Ramadan. Take care. Allah Hafiz.